Good morning to all. Clearly audible and visible, loud and clear. So this is a session where we will be discussing important high yield MCQs for our upcoming PG exam in particular. And these are the offers which are running around in relation to NEET PG Plus subscription as well as Iconic subscription. Bank 2.0 has also been launched, and these are the batch courses for upcoming exam. I think we are good to go. Clearly audible and visible now. Just acknowledge someone in the chat box. And you can access the live chat window to put in your answers for all the questions which we are going to discuss in relation to our upcoming PG exam. So again, a very good morning to all. Chalo shuru karte hain. Let us start with question number 1. Chronic lead poisoning presents with which of the following? You have to pick your answers from among these options A, B, C, and D, and then you have to put your answers from 1, 2, 3, and 4. Which all alphabetical presentations will be seen in chronic lead poisoning? Pick your correct answer out of 1, 2, 3, and 4. Simple question. Correct answer goes with correct answer. Let me see the fastest finger. Who answers this fastest? And that too correctly. So this is what matters in these exams, now, speed as well as accuracy. Out of 1, 2, 3, and 4, which one is correct about lead poisoning feature? Lead poisoning. 3 से जागो. कोई तो सही आंसर बताओ. Wake up. So chronic lead poisoning presents with, yes, circumoral pallor, colic and constipation. तो colic and constipation होता है. But lead poisoning leads to pure motor neuropathy, not sensory motor neuropathy. Pure motor neuropathy. ये गलत हो गया ना? The wrong option, because it leads to pure motor neuropathy. Peritoneal line, yes, blue line over gums can be seen in many metallic poisons, including lead, like mercury, copper, silver, bismuth, iron. They can present with peritoneal lines. This goes with lead poisoning. Aldrich mesaline is a feature of arsenic and thallium poisoning. So this is going to be wrong. These are white transverse line present over nails. कौन से सही है? A and C. Yes, option 2 is the correct answer. Na? Option 2 is the correct answer. Another. Chronic arsenic poisoning presents with. Put your answers among 1, 2, 3, and 4. So those who are joining now, this is question number 2 for the day. A very good morning to all. Put in your answers out of 1, 2, 3, and 4. Chronic arsenic poisoning presents with. Chronic arsenic poisoning, what happens is arsenic is redistributed from blood to body tissues like skin, hair, nails, and bones. And so are the findings. Mainly seen in skin, hair, nails, and bones. But the earliest feature of chronic arsenic poisoning is emaciation. Yes, this is true. Circumoral pallor is usually associated with lead poisoning events because lead leads to a sort of normocytic, normochromic, anemic picture. Then sideroblastic anemia can also occur in lead poisoning. Hyperkeratosis can be seen in arsenic poisoning when it gets deposited, when arsenic gets deposited in skin. And hyperkeratosis is defined as thickening of stratum corneum. Along with hyperkeratosis, yes, we can get raindrop pigmentation. But this last finding, punctate basophilia, is a feature of basophilic stippling, or punctate basophilia is the same thing. You see stippled appearance in the RBC cytoplasm called as punctate basophilia. So yes, again A and C is going to be correct. So option number 2 is going to be correct. Okay. These are the most important metallic poisons, na? Lead, arsenic, mercury, from where questions are picked. And recently in INI CET exam also you got a question in almost the same pattern. Which of the following is true about arsenic poisoning? Multiple options were given. These are the areas in toxicology which should be covered very nicely. Now answer this one. Medico-legal aspects of injuries is another topic, which is a high-yield topic for any PG or FMG exam too. So injuries produced voluntarily or intentionally by an accused, by which means dangerous means or weapon, is punishable under which of the following IPCs? यहाँ से pick करना है, and you have to put your answers among 1, 2, 3 and 4. बताओ, आंसर बताओ. All these are punishment sections for different types of injuries. Which of the following deals with punishment for injuries caused by dangerous weapons? That is the question. Simple question. So what is 323 IPC? Punishment for intentionally causing hurt to a person. What is 324 IPC? Causing hurt to a person by dangerous weapon or dangerous means. 325 on the other hand deals with punishment for causing grievous hurt to a person intentionally, and 26 deals with grievous hurt by dangerous weapon or means. Dangerous weapon वाली चीजें कहाँ कहाँ आती हैं? 324 and 26, B and D. Yes, B and D are correct. Option number 3 goes as the. This was answered nicely by many of you. Very good. Good to see. अब सबकी नींद भाग गई है. Now all of you are fully awake, fully conscious and oriented. Okay, this is the third question for the day. Answer this one. An 18-year-old boy was brought to emergency after being bitten by a saw-scaled viper. The monitoring which is most crucial in this patient is which of the following? Snake bite again is a high topic. You should be able to answer any question from snake bite. Mainly the questions are concentrated towards management aspect, diagnosis and management aspect. Here the correct answer goes with, in any viper bite, we know that V for vipers, and they are vasculotoxic. They are toxic to our vascular system. Coagulation pathway का derangement हो जाता है because of coagulation factors getting affected. The major effect is over fibrinogen level. So if fibrinogen levels are getting lesser, yes, fibrin clot formation will become defective, and this is detected with the help of 20-minute WBC test. WBC stands for whole blood clotting, and this test is performed over a time duration of 20 minutes. पूरा इसको क्या बोलते हैं? 20-minute whole blood clotting test. This test is repeated every 6 hourly. Why 6 hourly? Why not 2 hourly, 3 hourly? Why 6 hourly? Because suppose a viper bite has come to casualty and you see the person bleeding from gums, bleeding, internal bleeding signs are also noted by the doctor. So you will start giving polyvalent anti-snake venom. Polyvalent anti-snake venom. Now after giving this venom, anti-venom, this anti-venom will interact with the active venom, which is still yet to produce any effect. So this active venom is neutralized basically by PASB. This will help liver to maintain the levels of clotting factors as was normally present in the patient. But liver takes about 6 hours for this maintenance to be fortified. लिवर को कितना टाइम लगता है? 6 घंटे लगते हैं. इसीलिए ये टेस्ट हम कब करेंगे? 6 घंटे के बाद. Let us give time to liver for 6 hours to maintain the balances of coagulation factors, and thereafter again perform this test 6 hourly interval के बाद. Suppose this test is again positive. कैसे करते हैं वो सब तो सबको पता है ना. We take 2 to 3 ml of patient's blood in a test tube. We keep it in test tube rack for 20 minutes and then we note whether the blood has clotted or not. So this is usually seen when we tilt the test tube. After 20 minutes, if I am getting a fluid level, yes, the blood has remained unclotted. Why? Because of deficiency of clotting factors, which is due to the active venom. This is the utility of the test, WBC test, 20-minute WBC test, repeated every 6 hours. Next one. A 35-year-old man with history of alcoholism presents with some features. Treatment of choice. Treatment of choice. This is a repeat question of one of the exams. Alcoholic poisoning again is very important. सबको आंसर पता है, बच्चे बच्चे को पता है, तो पता है. अल्कोहल के बारे में नॉलेज काफी होता है. So yes, IV thiamine is the first agent of choice, and then we will supplement glucose. Why not glucose first and then thiamine? Why only thiamine is replenished first? Why only thiamine? Vitamin B1. We want कि vitamin B1 का level normal हो जाए. Why? ऐसी क्या खास बात है? ग्लूकोज भी तो दे सकते हैं. The person must be hypoglycemic because he is an alcoholic. क्योंकि अल्कोहलिक्स में ग्लूकोनियोजेनेसिस डिफेक्टिव रहता है. ऐसा क्यों? Yes, very good. Because this thiamine, if you will see this utilization of glucose, glucose का glycolysis से क्या होता है? Pyruvate बनता है. ठीक है. What is the fate of this pyruvate? With the help of this PDH complex enzyme, it is made up of 3 subunits. This is the subunit 1, subunit 2, and subunit 3. This PDH complex converts pyruvate into acetyl coenzyme A, and the first enzyme subunit needs this cofactor, thiamine pyrophosphate, the active form of thiamine. अगर thiamine का level low है, there will be no usefulness of giving glucose supplementation unless the vitamin B1 levels are full. In fact, it will be deleterious for the patient because if you give glucose without replenishing the stores of thiamine, more and more pyruvate से acetyl coenzyme में तो नहीं बन रहा है, but अब क्या बनेगा? Pyruvate से with the help of Cori's cycle, with the effectiveness of Cori's cycle, more and more lactic acid will be produced in the body. High anion gap, metabolic acidosis chances will be there in the patient. Okay? So the patient even might die if you give glucose first without replenishing the stores of thiamine. Which vitamins are needed for proper maintenance of this, one of the most important enzymes of the body? कौन-कौन से विटामिन चाहिए होते हैं? बताते जाओ. एक तो B1 हो गया, और दिख रहा है, सब कुछ दिख रहा है इसमें. एनी अदर विटामिन्स? बहुत सारे विटामिन्स चाहिए इसके. बहुत ही हंग्री एंजाइम है. This also needs vitamin B2, B3, B5. Along with that, it needs lipoic acid. Lipoic acid as a cofactor, which is present over here. ये question exam में आया हुआ है. They showed you this complex. यहाँ पर इन्होंने एंजाइम्स को गायब कर दिया एंड यहाँ पर एक मार्कर लगा के पूछा कि व्हाट इज दिस एंजाइम. इसको बहुत इजी याद रखना. एंजाइम सब यूनिट 1 and 3 आर डिहाइड्रोजेनेसिस. इतना तो याद रहेगा ना, ये डिहाइड्रोजेनेसिस है. एंजाइम 2 क्या है? एसिटाइलेज और असाइलेज. असाइल ग्रुप का ट्रांसफरेज है. तो असाइल ट्रांसफरेज और एसिटाइल ट्रांसफरेज. 1 and 3 are dehydrogenases. 1 is pyruvate dehydrogenase, 3 is lipoic acid dehydrogenase. Correct? So this was the answer. What will be your diagnosis based on these features? The person is going to go on a party. Global confusion, ophthalmoplegia, ataxia, peripheral neuropathy makes your diagnosis as Wernicke's encephalopathy. This can progress into course of psychosis, where the person will go into amnesia and confabulation. Amnesia means loss of memory. Confabulation means filling the memory gaps with false stories. आंसर दिस वन। ऑल ऑफ द फॉलोइंग फीचर्स आर प्रेजेंट इन ओपीसी पॉइजनिंग एक्सेप्ट। अब ये एक पॉइजन है, एग्रीकल्चरल पॉइजन ग्रुप है, जहां से एक क्वेश्चन हर एग्जाम में आता है, बिकॉज कॉमनली यूज होता है ना इंडिया में। तो ऑल ऑफ द फॉलोइंग यूज इसका है टू रिमूव द पेस्ट्स एंड इंसेक्ट्स, बट इफ कंज्यूम्ड पॉइजनिंग इवेंट विल अकर, so which is not seen in OPC poisoning. Now answer A, B, C, D, four options. Simple question है। OPC poisoning में muscarinic features होते हैं, nicotinic features होते हैं। Nicotinic features mainly are like muscle fasciculations. Finally, the muscles become paralyzed, and obviously the patient will be under some confusion कि क्या हो रहा है उसकी body में। So yes, confusion, fasciculations are seen. Fasciculations and finally muscles get paralyzed. तो मसल्स का टोन कैसा होगा, कम होगा ना, तो हाइपरटोनिया वोंट बी सी। ब्रोंकोरिया इज अ फीचर, a very important feature, increased secretions inside the body and from outside the body. So inside the body the secretions are increased like bronchoria, pulmonary secretions are increased, and secretions also come out in the form of sludge, salivation, lacrimation, urination, diarrhea, EIT distress, and E for emesis. All these are muscarinic features. Then features of bradycardia, bronchoconstriction, bronchoria, meiosis will be present in the patient, and your diagnosis will be instant. Answer this one. A 24-year-old male presents with consumption of unknown substance. ढूंढ के बताओ कौन सा unknown substance है based on the features. Pick the best answer. The best answer. The substance ingested most likely is. Rule out करके क्वेश्चन सॉल्व कर सकते। Try to rule out the option. एक ऑप्शन तो इजीली रूल आउट हो रहा है, डायजेपाम इज अ एंटी कन्वल्जेंट। अब अगर कोई डायजेपाम खाएगा तो सीजर थोड़ी होगा, तो यस, डायजेपाम कैन नॉट बी माय आंसर। करेक्ट। रेस्पिरेटरी रेट बढ़ा हुआ है, which option can be ruled out? Yes, opioid group of agents cannot be your answer. Why? Because opioids lead to decreased vital parameters, respiratory rate, heart rate, blood pressure सब कम होता है, यहाँ तो सब कुछ रेज्ड है, तो ये दोनों तो इजीली रूल आउट हो रहे हैं। अब बच जाता है इथेनॉल एंड एम्फेटामिन्स। Based on all the vital parameters to be very raised, to be highly raised, blood pressure is highly raised, pulse rate is also highly raised, along with that lots of seizure activity, tremors and hallucinations, they make your best answer of choice as amphetamines. इथाइल अल्कोहल इन जनरल अगर कोई कंज्यूम करेगा तो सीजर्स नहीं होंगे। इथाइल अल्कोहल इज अ CNS डिप्रेसेंट। इथेनॉल का काम क्या होता है? इट डिक्रीजेस द एक्टिविटी ऑफ NMDA receptors, N-methyl D-aspartate receptors, which mediate our glutaminergic response, and it increases GABAergic response. गामा अमीनो ब्यूटारिक एसिड जो नेगेटिव न्यूरोट्रांसमीटर है, तो नेगेटिव का लेवल तो ये बढ़ा रहा है, तो सीजर तो कभी चांसेस ही नहीं है इथेनॉल पॉइजनिंग में। यस, एम्फेटामिन पॉइजनिंग कैन प्रेजेंट लाइक दिस। तो रूल आउट करके क्वेश्चन सॉल्व हो रहा है ना, डायरेक्टली भी सॉल्व करना है एज वी हैव कवर्ड इन आवर रेगुलर क्लासेस। कैसे डिफरेंशियल डायग्नोसिस बनाते हैं बेस्ड ऑन द वाइटल चेंजेस, vital parameters which are given in the question and based on some of the important features. So yes, amphetamines leads to hallucinations, ये भी आपको बता रहा है, सीजर एक्टिविटी होता है। फिर एम्फेटामिन अब्यूजर्स में when you will see the mouth of the patient, you will see that teeth are crumpled, teeth are broken, and you will see bluish tinge over the teeth. So that mouth is called meth mouth. Additionally, these patients can also tell you the features of meth mites. They will say that over the whole body mites are crawling over my body, my whole body the mites are crawling. This is a sort of tactile hallucination. Similar feature almost is seen in cocaine also, cocaine and ergot poisoning too. There, the feature is given a name, Magnon symptoms. That is also a tactile hallucination, as if insects are crawling. Here, the word used is meth mites. The person keeps on scratching his skin. All these make your diagnosis as amphetamine poison. Answer this one. All of the following drugs can be used for treatment of, ये एक टॉपिक है जो बार बार आ रहा है पिछले 2 साल से ना, रेगुलरली इट इज बीइंग आस्क्ड इन पीजी एग्जाम्स इन पर्टिकुलर. इसका आंसर क्या होगा? एक्सेप्ट. दिस इज अ सैडेस्ट वर्ड. Sadism is giving pain to others and getting gratified. So answer क्या होगा? Best answer goes with clonazepam. Yes. Whereas bupropion, varenicline, nicotine gums, patches, inhalers, lozenges, they are first line therapies. Second line therapies क्या है smoking cessation की? Clonidine and nortriptyline. Clonazepam तो कहीं आता ही नहीं है. Out of the smoking cessation drugs, varenicline is the most effective agent, having highest effectiveness. Out of nicotine replacement therapies, nicotine lozenges are the most effective. ये दो facts याद रखने. Most effective NRT, which is a first line agent, is lozenges. Lozenges are something which you keep in the mouth and they dissolve on their own. Answer this one. फिर ये भी बहुत commonly asked topic है. A 7-year-old child comes to casualty. Easy question, easy answer. ऐसे questions में speed should be very high so that you save your time for other newer, lengthier questions. Yes, many of you have answered correctly. Very good. Dilated pupils, dry mouth, ये सब आपको force करता है answer करने के लिए कि ये धतूरा है. History of dysuria. All this makes your answer as Datura. Why? Because Datura contains active principles as atropine, hyoscine and hyoscyamin. यही होता है ना active principles. So all the features of atropine excess will be there in the body. Dry mouth, hot skin, dilated pupil, decreased secretions, dysuria, along with that dysphagia, painful swallowing, along with that dysarthria. Why this? All this happens because salivation हो नहीं रहा, secretions are decreased. Then the person will be drowsy. Drowsiness is a very common feature. Then the patient can show you drunken gait because of its stupefying nature. What is the antidote of choice? Antidote of choice, IV, physostigmine, increase 2B, which will increase the levels of acetylcholine and will counter the excess atropinergic effects. Neostigmine is not preferred. Why? Because it is not able to cross blood-brain barrier. This was asked in our last All India exam. Almost a question like this. This dysuria can progress to anuria. Why? Because secretions एकदम decrease हो रहे. So total absence of urination can also. Answer this one. Paresthesia, tetany, muscle twitches and muscle cramps are typical symptoms of poisoning. These are typical symptoms of poisoning with which of the following acid? कौन सा acid ऐसा करा? Acid which will be in love with calcium of our body. Out of that dangerous love, it takes calcium and forms something in the body. So yes, oxalic acid. Along with oxalic acid, any other poisoning event which can give rise to similar feature? Answer. Fill in the blanks. बचपन में करते थे ना fill in the blanks. तो ऑक्सैलिक एसिड के साथ एक और पॉइजन याद रखना है इसी फीचर्स के साथ. आंसर एनीवन? Ethylene glycol. Ethylene glycol used as antifreeze in vehicles. It is a fluorescent thing, bluish greenish fluorescent thing used in coolant, used in vehicles as antifreeze. अब जरा ये बता दो ऑक्सैलिक एसिड पॉइजनिंग का एंटीडोट क्या होगा? Antidote of oxalic acid poisoning. Answer will be to supplement the levels of calcium. So we give IV calcium gluconate. What is the antidote of choice for ethylene glycol poisoning? What is the antidote of choice for ethylene glycol? सेम है या कुछ और है? इसमें भी तो हो रहा है ना हाइपोकैल्सेमिक फीचर्स, इसमें भी वही आंसर कर देंगे या समथिंग एल्स? Here the answer will change to fomepizole because of the simple fact that ethylene glycol is metabolized by the same enzymes which metabolize our alcohol, ethyl alcohol and methyl alcohol. पहला एंजाइम अल्कोहल डिहाइड्रोजनेज लगता है, व्हाट इज प्रोड्यूस्ड इज ग्लाइकॉल एल्डिहाइड. सेकंड एंजाइम व्हिच कम्स इनटू पार्टिसिपेशन इज एल्डिहाइड का मेटाबॉलिज्म करना है, एल्डिहाइड डिहाइड्रोजनेज. तो यहाँ प्रोड्यूस हो जाता है ग्लाइकोलिक एसिड. इस ग्लाइकोलिक एसिड से द फाइनल मेटाबॉलिक प्रोडक्ट्स व्हिच आर ऑब्टेन्ड आर ऑक्सैलिक एसिड एंड फॉर्मिक एसिड. Formic acid is itself very dangerous for the body. Oxalic acid is dangerous because it can cause hypocalcemic tetany episodes. बट ये प्रोडक्ट्स एकदम लास्ट में बन रहे हैं. तो हम एंटीडोट क्या यूज करते हैं? द एजेंट विच कैन इनहिबिट द मेटाबॉलिज्म इन द फर्स्ट स्टेप इटसेल्फ. तो वी गिव इनहिबिटर ऑफ अल्कोहल डिहाइड्रोजनेज, दैट इज फोमेपिजोल. इसलिए एंटीडोट चेंज हो जाता है यहाँ. एंड बोथ ऑफ दीज एजेंट्स कैन फॉर्म विच क्रिस्टल्स? कैल्शियम ऑक्सलेट क्रिस्टल्स. Calcium oxalate crystals in the body. Now these calcium oxalate crystals are of two types, bihydrate crystals and monohydrate crystals. Bihydrate वालों का शेप कैसा होता है? Bihydrate ones are shaped like लिफाफे की तरह, envelope shaped. Envelope has got bisecting lines. ये याद रहेगा आपको, bisecting lines goes with bihydrate. Monohydrate crystals का शेप कैसा होता है? Dumbbell shape like this. A dumbbell shape. Very good. And in poisoning events में which crystals are mostly seen? ये ध्यान में रखना है. Bihydrate ones are mostly associated. Monohydrate वाले कम मिलते हैं. Bihydrate crystals are mostly associated with these two poisoning events. That is envelope shape. इसीलिए ये क्वेश्चन बार बार आते रहते हैं क्योंकि ये मोस्ट कॉमनली देखा जाता है. चलो नेक्स्ट. एंजाइम एक्टिवेटेड इन अ केस ऑफ लेड पॉइजनिंग. एंजाइम एक्टिवेटेड, कौन से एंजाइम सुपर एक्टिव हो जाता है? अब इसमें आला डिहाइड्रेटेज लगाना इज लाइक पाप है, इज अ सिन टू मार्क. क्यों? क्योंकि आला डिहाइड्रेटेज तो बेचारा इनहिबिट हो रहा है. तो अगर लगा दोगे कि एक्टिवेट हो रहा है तो आला डिहाइड्रेटेज दुखी हो जाएगा. दुखी नहीं करना है उस एंजाइम को. Let us keep the enzyme happy. The enzyme which gets activated and becomes happy in a case of lead poisoning is ALA synthase. Because lead has an effect over heme synthesis pathway. कैसे शुरू होता है? Glycine combines with succinyl coenzyme A in the presence of pyridoxal phosphate, that is vitamin B6 used as a cofactor. And यहाँ पर जो enzyme लगता है that is ALA synthase. So what is produced is delta ALA, delta amino levulinic acid. इसका फर्दर स्टेप्स में मेटाबॉलिज्म होता है. एंड देन द एंजाइम्स व्हिच पार्टिसिपेट हियर इज आला डिहाइड्रेटेज, कोप्रोपोरफायरेनोजन ऑक्सीडेज एंड फेरोचिलेटेज. ये तीनों एंजाइम्स इनहिबिट कर देता है लेड. तो जब ये एंजाइम्स इनहिबिट होंगे तो इस पाथवे का काम क्या था? हीम को बनाना, हीम सिंथेसिस पाथवे. हीम प्रोडक्शन विल बी डिक्रीज्ड इन अ लेड पॉइजनिंग केस. देयर विल बी अ नेगेटिव फीडबैक रिएक्शन. इस एंजाइम को भाई अपना एक्टिविटी बढ़ाओ, heme is less in the body. That is why we say ALA synthase is the rate limiting enzyme. This enzyme activity will be super active in lead poisoning. Okay? And these are the enzymes which are inhibited. ALA dehydratase, coproporphyrinogen oxidase and ferrochelatase. अभी recently FMG exam से मैं पूछा गया which of the following enzyme is affected in lead poisoning? See the English affected. So affected enzymes are these ones. These enzymes are inhibited ones. So there the answer was ferrochelatase. आला डिहाइड्रेटेज का भी सिनोनिम है. ये तो हद हो गई, हाइट्स ऑफ सैडिज्म. आला डिहाइड्रेटेज का सिनोनिम क्या है? This is also called as PBG synthase, पोर्फोबिलिनोजन सिंथेस। इस रिएक्शन में क्या प्रोड्यूस होता है, डेल्टा आला से पोर्फोबिलिनोजन, इसलिए इस एंजाइम को बोला जाता है पीबीजी सिंथेस। नेक्स्ट टाइम मान लो आलाडिहाइड, ये क्वेश्चन ऐसे फ्रेम करें, एंजाइम इनहिबिटेड इन केस ऑफ लेड पॉइजनिंग, आलाडिहाइड्रेटेज की जगह पीबीजी सिंथेस दे दिया, ये ध्यान में रखना है, कॉमनली आस्क्ड क्वेश्चन। दिस वन, एक क्रॉनिक अल्कोहलिक में कुछ कुछ हो रहा है, व्हिच एरिथमिया इज मोस्ट लाइकली टू बी सीन। क्रॉनिक अल्कोहलिक में कुछ हो रहा है इन द फॉर्म ऑफ पैल्पिटेशन, तो अपने हार्ट बीट फील हो, अब कौन सा एरिथमिया के चांसेस मोस्ट लाइकली, दिस इज व्हाट इज कॉल्ड हॉलिडे हार्ट सिंड्रोम, कैन अकर विद binge drinking of 5 to 6 drinks very quickly, and the arrhythmias most commonly associated with this phenomena is atrial fibrillation, correct, atrial fibrillation, also called as holiday heart syndrome। इसका आंसर बताओ। 8-year-old child ने कुछ खा लिया और कुछ कुछ हो रहा है बॉडी, which is the most likely agent which the child has consumed। and these tablets were peculiarly, ये दिया हुआ है हिस्ट्री, बहुत इंपॉर्टेंट हिस्ट्री, मदर खा रही थी। Now features of gastric necrosis, metabolic acidosis, shock like condition, along with that liver damage makes your answer towards iron poisoning। और ये क्वेश्चन INI-CT में कैसे आया, मैच द स्टेजेस ऑफ आयरन पॉइजनिंग विद द सिस्टम इन्वॉल्व। व्हाट आर द, लेट अस डू अ क्विक रिकैप। स्टेज 1 ऑफ आयरन पॉइजनिंग क्या होता है, स्टेज 1 इज GIT stage, which lasts for initial 6 hours, where the patient will have GI bleeding episode features, इसको हम बोल देते हैं गैस्ट्रिक नेक्रोसिस, ठीक है, GIT स्टेज हो गया। स्टेज 2 कौन सा होता है, रिकवरी स्टेज। If the antidote, that is desferrioxamine, is given, the patient will recover, and this recovery phase is between 6 to 24 hours। अगर यहाँ पर ठीक नहीं हुआ या antidote adequate treatment नहीं मिला, now the patient can pass on into third stage, which is going to involve multiple systems, CNS, CVS, and metabolic complications। Metabolic complications can occur between 24 hours के बाद 1 day हो गया ना, 1 to 2 days। और उसके बाद स्टेज 4 क्या हो जाता है, हिपैटिक स्टेज, हिपैटिक स्टेज बिटवीन 2 to 4 days। अब क्या होगा, जो GI ब्लीडिंग हो रहा है GIT स्टेज में, तो जो प्रोडक्ट्स निकल रहे हैं वो क्या बनाएंगे फाइनली, हीम का डिग्रेडेशन हो तो क्या बनेगा फाइनली, बिलिरुबिन। The person will present with jaundice like features and liver damage condition will be happening। And stage 5 is after 5 days till week, what will happen is many complications can occur throughout the GIT। Why? Because GIT में gastric necrosis, GI bleeding episodes हो रहा था, तो जब healing का process शुरू होगा, due to body defense mechanism, macrophages will come by about 5th day, they will induce fibrosis। You can see fibrous bands throughout GIT, in the esophagus, in the intestines। Now the patient will be needing multiple surgeries to remove the strictures। These are the stages, and the antidote preferred is desferrioxamine। The stages along with the system involved, along with the time duration, needs to be remembered। A repeat question, answer this one। A 3-year-old child develops severe respiratory distress, this all we have covered in our classes, all the important poisons now। 3-year-old child develops severe respiratory distress after burning plastic, ये लिंचर दिया हुआ, the child is started on supportive ventilation, which antidote need to be given। Single best answer of choice will be, single best answer of choice will be hydroxycobalamin। Hydroxycobalamin, hydroxycobalamin will combine with इस प्लास्टिक बर्निंग से या फर्नीचर बर्निंग से इन फ्यूम्स में मेजर कॉन्सेंट्रेशन किस टॉक्सिक एजेंट का होता है साइनाइड्स का। साइनाइड्स के साथ CO भी होगा, कार्बन मोनोऑक्साइड भी होगा, and other toxic gases will also be there. But burning of plastics, burning of furniture, because these plastics and furniture material, they contain lots of nitrogen. When they burn, they produce lots of cyanide. तो हमें क्या करना है कि ये साइनाइड बेसिकली साइटोक्रोम ऑक्सीडेजेस के साथ कंबाइन करके एक कॉम्प्लेक्स बना लेते हैं। हमें इस कॉम्प्लेक्स को ब्रेक करना है, where hydroxycobalamin is very handy. In one step itself, cyanocobalamin will be produced and my cytochrome will become free. And that cyanocobalamin is a water soluble agent. It will be excreted from the body. Amyl nitrite, sodium nitrite भी use करते हैं. They are used as methemoglobin generators. They generate methemoglobin in the body. इस methemoglobin का काम क्या होता है? इसी कॉम्प्लेक्स के साथ एक्ट करेगा and it will produce cyanomethemoglobin and cytochrome free हो जाएगा. बट दिक्कत क्या होती है कि साइनोमेथेमोग्लोबिन इज नॉट एबल टू बी एक्सक्रीटेड फ्रॉम द बॉडी. इसीलिए हमें क्या जरूरत पड़ेगा? एक और एजेंट का, सोडियम थायोसल्फेट, which acts as a sulfur donor. So when sodium thiosulfate combines with cyanomethemoglobin, thiocyanate is produced, which is water soluble. NAC तो आंसर हो ही नहीं सकता. NAC is the antidote usually used for PCM toxicity, paracetamol toxicity or acetaminophen toxicity. So single best answer goes with hydroxycobalamin, which is used as a direct binding agent. Correct composition of black gunpowder. One second. Correct composition. जिपमर एग्जाम क्वेश्चन तुम पढ़ते ना क्लास में. Along with the percentages, you should remember, and the trick to remember the percentages is longer the name, more the alphabets, more is the percentage. More the alphabets, more is the percentage. सबसे कम alphabet sulfur में, least percentage. Yes, PCS makes your black gunpowder. Potassium nitrate 75%, charcoal 15, and sulfur 10%. Goes as the best. Few one-liner questions. Poroscopy. Poroscopy क्या होता है? Study of micron size sweat gland pores. Sweat gland के pores होते हैं कहाँ पर? Over epidermal ridges. Over epidermal ridges. Dermal ridges. So ये study called poroscopy used for identification purpose, and this is also unique for individuals. हमारे ridges के ऊपर there are micron size pores at regular intervals. The study was done by Locard's. Locard's has also given us Locard's principle of exchange, which says whenever two things come into contact, there will be exchange of matter between them. Answer this one. All are associated with burns of HF6. Correct answer goes with option B. Yes, hydrofluoric acid can give rise to hypomagnesemia, hypocalcemia, and yes, it is having H plus ions and fluoride ions. So lots of H plus ions will be increased in the body. The chemical formula HF6. And this is the unique acid. Why? Because it leads to which type of necrosis? Coagulative or liquefactive? HF6 in particular leads to which type of necrosis? It acts like alkalis. Alkalis have a L and they lead to liquefactive necrosis. This acts like alkalis and leads to liquefaction of tissues. Whereas all other acids having a C alphabet, they lead to coagulative necrosis. तो इसके मैनेजमेंट में क्या क्या यूज कर सकते हैं? मैग्नीशियम सल्फेट यूज कर सकते हैं, कैल्शियम ग्लूकोनेट यूज कर सकते हैं टू रिप्लेनिश द लेवल्स ऑफ these electrolytes. Identify the USG sign seen in this dead born fetus. Simple है. Overriding of skull walled bones over each other is seen. Skull bones are overriding over each other, called as Spalding sign. Seen at about 5 to 7 days of fetal death. when the fetus has died inside uterus. This is how we define dead born fetus or intrauterine death of the fetus. Ball sign क्या होता है? The fetus assumes the shape of a ball, roughly can be seen due to hypermobility of the spine at about 2 to 3 days. What is dual sallow sign, which is seen roughly at about 3 days of fetal death inside uterus? You will see a hollow area, empty area between scalp and skull bone. Normally there is no empty area. This empty area is due to enzymatic autolysis, which is happening in this dead fetus. Autolysis is aseptic procedure. उस autolysis से भी gases produce होते हैं and they create a hollow area between scalp and skull called as dual sallow sign. Robert sign क्या होता है? When this process of autolysis produces gases in great vessels like aorta, we say Robert sign is present, and this is seen at about 12 hours of death. So basically all these USG signs, when the USG is being done of the mother, they are telling me time since death. This is the medico-legal importance of these USG signs. You can estimate time since death of the fetus without removing the fetus. You are telling the time since death. In an examination of a victim of sexual assault, toluidine blue dye का क्या use है? Toluidine blue dye is used for. This is used to identify recent micro injuries. Mainly which injuries? Micron size lacerations. Lacerations इतने छोटे हैं कि we are not able to appreciate the margins. Unless we look irregular margins, we cannot say that the injury is a laceration. तो ये toluidine blue dye क्या करता है? It highlights the margins. Micro lacerations के margins पे highlight हो जाते हैं, and with a hand lens we can see the micro injuries. We can appreciate the margin. Hymen examination is facilitated by which instrument? What is the name of that instrument which is used to examine hymen and its tears in such cases? That instrument is called Glaster keen rod. Glaster keen rod. This is a bent glass or plastic rod with a spherical head over one end. So GK rod. GK rod is used to increase the general knowledge of hymen. This is the how we remember now. GK rod for general knowledge. General knowledge मतलब examination of hymen. GK will help you remember कि GK stands for Glaster. Answer this one. Autopsy was performed on a case of firearm. बताओ answer बताओ. Which fracture line has occurred before the second? Correct answer goes with Puppy's rule. सबको पता है, ठीक है? In case of multiple fractures to the skull vault, so this is the skull vault, and I say that there is a firearm entry wound over here. Along with that, you are seeing fracture of a skull bone like this. Okay. Then you are noticing another firearm entry wound, black color, and the black color fracture lines are getting limited by red color fracture lines. That means red one is the first shot and black one is the second shot. Basically, we are able to tell the sequence of shots fired. The upcoming fractures will be limited by previous fracture lines. That makes one as the red one as the first shot. This is what is Puppy's. ये करो मैचिंग, बहुत ही सिंपल मैचिंग है. ABCD यहां से आंसर पिक करना है. ABCD. Almost similar question came in INI-CT 2 to 3 years back. एक चीज देख के आंसर सॉल्व हो. एक ट्रिक याद रखें. इज दैट ट्रिक? फ्रैक्चर सिंबल में which number is hidden? Number 7. So causing of fracture, dislocation of any bone or tooth will be clause 7. फ्रैक्चर सिंबल में नंबर 7 हिडन है. तो यस, आई एम सीइंग कि 1 तो बी के साथ जा रहा है, बाकी मुझे नहीं पता. देन आई एम सीइंग कि 1 तो बी के साथ जा रहा है और ये किसी और ऑप्शन में है ही नहीं. आई विल मार्क बी एज द आंसर ऑफ चॉइस एंड आई विल गेन फुल मार्क्स. ऐसे क्वेश्चंस छोड़ने नहीं है. मैच द फॉलोइंग क्वेश्चन, दे आर मार्क फेचिंग क्वेश्चन. It's even knowledge of one or two things, you will be able to mark the question correctly. So always attempt match the following questions. भले ही नए हो, you read it again ना, you will get some or the other hints in the question. तो एक बार quickly revise कर लेते हैं. Clause 1 deals with emasculation. Clause 2 deals with permanent privation of vision of either eye. Clause 3 is permanent hearing loss of either ear. Then permanent privation of hearing of either ear. Clause 4 is permanent privation of any member or joint of the body. Clause 5 भी member और joint के साथ related है. वहां पर क्या होता है कि due to any injuries if there is destruction of power of member or joint of the body. Clause 6 is permanent disfiguration of head or face. Clause 7 तो हमें पता है, fracture dislocation of bone or tooth. Clause 8 भी सबको पता है, any hurt which endangers life or which causes two things for 20 days. Either of the two things for 20 days. Which two things? Severe bodily pain to the patient, or the patient is unable to follow his daily routine activities or ordinary pursuits of life. तो ये clauses उसी sequence में याद रखने हैं as given in 320 IPC. Assault to a woman with intention to disrobe her comes under which of the following sections? Sexual offense के sections and injuries related sections are any day important. ये दो एरियाज हैं जहां पर सेक्शंस को एक बार रिवाइज कर लें, बाकी भले ही छोड़ दो, बट ये दो एरियाज को कवर कर. Nowadays IBC related questions are not being asked. That is a very good step. But yes, sexual offenses and injuries वाले ना हमारे प्रोफेशन के साथ बहुत कोरिलेटेड है. When the cases come in casualty ना, you should be aware of all these laws. That is why they will always remain important. इसमें आंसर हो जाएगा 354B. ठीक है, करेक्ट. 354B goes as the correct answer. 354 deals with outraging the modesty of a female. Modesty is the virtue which a female has owing to her gender. We males, we don't have any modesty, legally speaking. Outraging the modesty of a female by use of force is punishable under 354. Outraging the modesty of a female by use of words or by use of mouth is punishable under 509. ये दोनों sections इस कॉमन चीज के साथ डील करते हैं. Outraging the modesty of a female. 354A deals with sexual harassment to a female. हमारा ट्रिक क्या है याद रखने का? harassment का A goes with 354A. harassment. 354 goes with disrobing. Disrobe has got B alphabet. Disrobe means to undress a female. 354C is also there. C goes with voyeurism. 354C goes with voyeurism, also called as peeping tom, and 354D goes with whoever is following a female physically or digitally with prior disinterest shown by the female, called as stalking a female. All these are sections in relation to sexual offenses to a female. These are one-way sections. Answer होगा. When the consent is being taken from the person in charge of the child, this is what is called loco parentis. Compos mentis तो सबको पता होगा. Compos mentis means a person having a sound mind. Sound. Mens rea क्या होता है? Mens rea means criminal mind. Criminal mind. And a criminal minded person is known to do actus reus, means the criminal act. So what are the two essential components of a crime? These two aspects. ये दोनों जब मिल जाते हैं तो क्या हो जाता है? Crime हो जाता है. Crime is being done by a person. Then a person is having anti-social mind. Anti-social element है. Antisociality is a feature of which cerebral lobe disorder? Frontal, parietal, temporal, occipital, also called as frontal disinhibition syndrome. कौन से लोब के डिसऑर्डर से होता है? फ्रंटल. फ्रंटल लोब का डैमेज होगा तो एंटी सोशल बिहेवियर इज सीन इन द पेशेंट. All of the following tests can be used to assess the lies of a witness except में आंसर जाएगा जल्दी. Galton system. Galton system is another name for fingerprinting method of identification, which is also called dactylography, dermatoglyphics. Dactylography and dermatoglyphics are other synonyms. Whereas polygraphy, narco, brain fingerprinting, they are tests which can catch lie of a person. Before doing these tests, consent is mandatory. Prior consent is mandatory. And the results of these tests are inadmissible in courtroom as an evidence directly. Like the person saying that I have killed someone, that statement cannot be used against the person as a evidence. But yes, the results will help the investigating authorities to solve the crime. It has got a corroborative. These are two very important lines to be remembered. This was asked in NIMHANS exam few years back. तब ये एग्जाम सेपरेट होते हैं. तो पॉलीग्राफी में क्या करते हैं? जस्ट few lines about पॉलीग्राफी में क्या करते हैं? We tell the person to sit over a chair and उस person से हम कुछ questions पूछते हैं. Some relevant and some irrelevant questions related to the matter in investigation. जिस केस पे इन्वेस्टिगेशन हो रहा है उस केस से रिलेटेड कुछ रेलेवेंट एंड इररेलेवेंट क्वेश्चंस पूछते हैं. एंड changes in vitals, changes in sweating effect, all these changes are noted. Vital changes, sweating हो रही है नहीं हो रही है. So when a person tells a lie, there will be large fluctuations noted in the vitals. ऐसे करके पोलीग्राफी से झूठ पकड़ लेते हैं. नार्को में क्या करते हैं? We give a truth serum drug called scopolamine or we can use thiopentone sodium. तो नार्कोसिस में क्या होता है? अंडर द इफेक्ट ऑफ नार्कोसिस द पर्सन विल ऑलवेज टेल ट्रूथ. वो सारी कहानी बता देगा आपको. हिज लाई विल बी कॉट. ब्रेन फिंगरप्रिंटिंग क्या होता है? ब्रेन फिंगरप्रिंटिंग इज अ टेस्ट जहां पर अगेन इस आदमी को चेयर पे बिठाया एंड ओवर हिज स्कैल्प इलेक्ट्रोड्स आर प्लेस्ड. ओवर हिज स्कैल्प इलेक्ट्रोड्स आर प्लेस्ड. कौन से इलेक्ट्रोड्स? ईजी इलेक्ट्रोड्स. ये ईजी इलेक्ट्रोड्स हमने लगा दिए इस स्कैल्प पे एंड इसको कनेक्ट कर दिया ईजी ग्राफ के साथ. अब इसके बाद ये आदमी झूठ बोल रहा था कि नहीं आई हैव नॉट डन दिस क्राइम, आई एम नॉट अटैच्ड टू दिस पर्सन. अब इस आदमी को क्या करते हैं कि वी शो समथिंग इन रिलेशन टू द क्राइम. या तो उसको दिखा दो या सुना दो. ईदर स्टिमुलस इज गिवन इन द फॉर्म ऑफ विजुअल स्टिमुलस और ऑडियो स्टिमुलस. पर्सन इज टेलिंग अ लाई but his brain will recognize that I have seen this thing. Brain has got a memory, and what will the brain start to do? It will start to release memory related potentials, and these potentials will be caught on the graph, and these potentials will be released every 300 millisecond. इसीलिए ब्रेन फिंगरप्रिंटिंग को एक और नाम से बुलाते हैं P300 टेस्ट. because these memory related potentials are released. तो आदमी तो झूठ बोल रहा है, ब्रेन झूठ नहीं बोलता. That is what is brain fingerprint. Answer this one. Punishment for breaching professional secrecy is all except. Punishment for breaching. नया क्वेश्चन है, न्यूली फ्रेम्ड क्वेश्चन. सोचो. Best answer goes with option. जो हम पढ़ते हैं ना कि it is every doctor's obligation to keep secret all information of the patient which you have come to know during course of treatment of the patient. हमें वो secrets को secret ही रखना है. If you breach professional secrecy, these are the actions which can be taken. The patient can file a defamation case under 499 IPC. He can take you to consumer courts for monetary compensation. And if the complaint is made to state medical council, state medical council can take disciplinary action. It is a sort of unethical act on part of a doctor. Correct answer goes with option. Arrange the age of operation according to their color change with time, lower to higher. तो करो, तो बनाओ. अल्फाबेटिकल सीक्वेंस बनाना है आपको, ए बी सी डी सी डी ए बी जो भी बन रहा है इस सीक्वेंस में लोअर टू हायर टाइमलाइन. सबसे पहले कौन सा कलर होता है, उसके बाद कौन सा होता है, लाइक दैट. लोअर टू हायर मतलब इनिशियल टू लेट. आंसर गोज विथ. ऐसे क्वेश्चंस अगर आ जाए ना बाई चांस एग्जाम में, तो क्या याद रखना है, रेडिश ऑपरेशन इज सीन विद इन 12 आवर्स. ये टाइमलाइन याद कर लो, रिवाइज कर लेते हैं. रेडिश स्कैब ऑपरेशन between 12 to 24 hours. Reddish brown scab aberration between 1 to 3 days. Brownish black scab aberration between 4 to 5 days. और ये तो हमें याद रहता है, ब्राउन कलर चेंज के लिए 4 days याद रखना है. बस आंसर सिंपल हो जाएगा. सीक्वेंस आपका आ जाएगा डी सी ए. इसको भी करो. अरेंज द लेवल ऑफ जजेस अकॉर्डिंग टू देयर पावर्स, अकॉर्डिंग टू देयर हायरार्की. तो हायरार्की इज बेस्ड ऑन द पावर्स. तो लोएस्ट लेवल ऑफ जज से लेकर हायर लेवल ऑफ जज तक अरेंज करो अल्फाबेटिकल सीक्वेंस. This will help you revise the power of judges and the hierarchy of judges. If you make a mistake, you will correct yourself. Try करो. थोड़ा सा मैंने इसको टफ बना दिया, but हाँ, you have read the topic and if you have revised it, you will be able to solve it. Correct answer goes with. तो इसमें भी ना आपको थोड़ा ध्यान देना होगा, पूरा टॉपिक रिवाइज करना होगा अच्छे से. और क्या ध्यान देना होगा, प्रिंसिपल मैजिस्ट्रेट इज अ नेम यूज्ड फॉर फर्स्ट क्लास जुडिशियल मैजिस्ट्रेट. तो ये नाम कहाँ पर यूज करते हैं, जुवेनाइल कोर्ट्स. इन जुवेनाइल कोर्ट्स द फर्स्ट क्लास जुडिशियल मैजिस्ट्रेट्स आर कॉल्ड एज प्रिंसिपल मैजिस्ट्रेट. इन्हीं फर्स्ट क्लास जुडिशियल मैजिस्ट्रेट्स को मेट्रो सिटीज में क्या बोल देते हैं, मेट्रोपॉलिटन मैजिस्ट्रेट. करेक्ट. Then chief metropolitan magistrate is the name used for which rank of judge, chief judicial magistrate. In which cities, metro cities. Metro cities में CJM को क्या बोल देते हैं, CMM, chief metropolitan magistrate. अब चीजें आसान हो जाएंगी. नाउ यू नो कि जुडिशियल मैजिस्ट्रेट्स में सेकंड सबसे लोएस्ट लेवल है. जस्ट लाइक रेलवे ट्रैक, रेलवे की जो बोगीज होते हैं, रेलवे कोचेज होते हैं, उसमें सेकंड क्लास लोअर लेवल होता है, यहाँ भी वैसे ही जाते हैं. Second class is the lower level, then comes first class judicial magistrate and then comes CJ. अरेंजमेंट आ जाएगा ना, सी बी. और डिस्ट्रिक्ट लेवल पे तो आपको पता है असिस्टेंट लोअर लेवल होता है एंड देन कम्स एडिशनल सेशन जज एंड देयर आफ्टर कम्स डिस्ट्रिक्ट जज. तो CBAD इज द करेक्ट सीक्वेंस. किसी ने बनाया सही? हाँ, few people have answered it correctly. So this is the additional information which you need to have to solve any such. ये इंपॉर्टेंट एरिया है ना, जुवेनाइल जस्टिस एक्ट इज इंपॉर्टेंट एक्ट. इसको भी सॉल्व कर लो. लास्ट क्वेश्चन फॉर द डे. अरेंज द एज ऑफ ब्रूज अकॉर्डिंग टू द कलर चेंज विद टाइम. तो इसमें भी लोअर टू हायर जाना है. सबसे पहले कौन सा कलर चेंज एंड लेटर ऑन कौन सा. ये सिंपल, ये बना लोगे सब. अरेंज द एज ऑफ ब्रूज अकॉर्डिंग टू द. तो ये तीनों हायरार्की वाली चीजें ना एक साथ रिवाइज कर ले. ऐसा हायरार्की है ना सबका, लोअर टू हायर, लोअर टू हायर. तो यहाँ भी रेडिश ब्रूज इज सीन विद इन 3 आवर्स ऑफ द इंजरी. फिर आपको याद आ जाएगा ब्लूइश ब्रूज बिटवीन 3 आवर्स टू 3 डेज ऑफ द इंजरी. और उसके बाद BBG येलो याद रखना है. रेड एंड ब्लू के बाद क्या याद रखना है, रेड के बाद क्या याद रखना है, BBG येलो. एक तो ब्लू हो गया, ब्लू के बाद ब्राउनिश या ब्लूइश ब्लैक बोल देते हैं. G फॉर ग्रीन, Y फॉर येलो. तो रेडिश ब्रूज विद इन 3 आवर्स, ब्लूइश ब्रूज 3 आवर्स टू 3 डेज. तो ब्लूइश ब्लैक और भी से ब्राउन ऑन 4th डे. ग्रीनिश कब मिलता है, 5 to 6 डेज. येलोइश कब हो जाता है, बिटवीन 7 to 12 डेज. तुम्हारा टाइमलाइन आ गया. तो अरेंज कर लो B A D BADC, गलत नहीं करना। तो ये BBG येलो याद रखोगे ना, ब्लू देन ब्लैकिश, उसके बाद ग्रीनिश येलोइश, ब्लू, फिर ब्लू ब्लैक या ब्राउन बोल लो, G फॉर ग्रीन, Y फॉर येलो. This will help you recall. So that's all for today, and we have a special session from 11:30 a.m. onwards today itself till 12:30, where we'll be revising few important MCQs as well as images today. Images mainly from toxic plants, and few other things which were told by the student. So ji, bye bye, bye bye. All the very best to all of you. Keep your spirits high and keep on working till you achieve for which you are reading right now. जब तक वो चीज अचीव नहीं हो जाए ना, don't stop. Keep your momentum up. चलो bye bye, bye bye.